Hello, welcome, and thank you for joining us for the October episode of Chang Reaction. I am Taylor Young, Assistant Director of the National Keratoconus Foundation. We are a patient advocacy program based in Southern California at the University of California, Irvine. NKCF provides information to patients and their families and raises public awareness of this cornea disease. We invite you to visit our website, nkcf.org, and sign up for our newsletter and to register for our bi-monthly webinars. We also post news on our Instagram and Facebook pages. This is Chang Reaction, our Ask the Expert podcast. Our partner for this endeavor is Dr. Clark Chang, a noted keratoconus expert and friend of NKCF. We often receive questions about life with keratoconus, and Dr. Chang has offered to share his advice on these questions. NKCF records and archives these episodes for the public. You can view past episodes by going to nkcf.org/webinars. Dr. Chang is currently the Director of Specialty Contact Lenses on the Cornea Service at Wills Eye Hospital in Philadelphia. He is also a member of the Medical Affairs team at Glaukos, which is the company that makes the FDA-approved crosslinking product and equipment. He is a graduate of the Pennsylvania College of Optometry and a fellow of the American Academy of Optometry. Dr. Chang was also named the NKCF Top Doc in 2020. Hello, Dr. Chang.
Hello, Taylor. How are you today? And welcome everyone to episode number 7.
I'm excited for this one. We received some interesting common questions this week, questions that we get a lot to the foundation via phone and email, so it will be a good one.
Yeah, I'm really looking forward to answer everybody's question, but before that, I want to go back to, remember a few episodes ago, we were updating everybody on the what's happening at NKCF and myself and where we're going to be next. And I had mentioned that there's an article that, or more like a monthly column style article that I was asked to author by American Optometric Association. It was coming out in their, both online and in their printed magazine called AOA Focus. I just received it hot off the press yesterday, so I wanted to show everybody that it is here. We're gonna try to see if we could find a link that can be made public. Let's see, Taylor, can you see this?
Yes, it looks great.
Right, I don't look all that different, right? Look at that hair. But anyway, so it does contain some of the new research, as much as I can in like 350 words, a little bit on cross-linking, a little bit on new contact lens design. So I welcome everybody to look it up. And as soon as we get the link to share, Taylor will be able to add it in the comment section of this video. So look out for that. All right,
That's
so
very
let me show
exciting. Okay, so our first question this month comes from Scott. And Scott asks, can keratoconus be permanently cured?
Right. If Taylor and I get a nickel every time we get this question, right, Taylor? Because it is such a good question. And so, Scott, currently there's no cure for keratoconus, but there is a FDA approved. If you have been following our podcast, you know that we've talked about FDA approved cross-linking within US, and obviously there are similar treatments outside the US as well. But the FDA approved method has been shown to slow down or halt, which means stop, the progressive keratoconus. I don't look at that, however, as a cure though. So I do want to kind of, distinct the difference between the two. But in the current situation, one would think that's almost as close as possible in terms of slowing down the symptoms and the deterioration in their vision and other challenges that keratoconus patients do face once they are able to, have access to the cross-linking treatment. But keeping in mind that the FDA approved cross-linking is indicated for progressive keratoconus patients. So this means that keratoconus has already been documented and diagnosed, and that your eye doctor have actively looked for progression in your condition, hopefully as little as possible prior to being able to offer you the treatment, because the treatment goal then at that point is not looking for reversal necessarily, but after detecting the progression in keratoconus, the treatment goal after that is to stabilize and try to maintain as much as possible, so that disease stabilization at the very earliest stage of progressive keratoconus, and hopefully also prior to detection of very severe or aggressive amount of progression, that would then be able to allow us to offer the highest level of clinical benefits to progressive keratoconus patients. And that's also another reason why it's very important for keratoconus patients to maintain a very regular and frequent eye exam schedule as determined by their eye doctors, because this helps to detect hopefully the smallest amount of progression prior to, again, being able to have access or be provided that the FDA-approved cross-linking treatment, because we don't want a very severe progression or loss of vision to take place for you, so that we could keep the best part of your vision, and that you would hopefully also have some peace of mind as keratoconus patient. And just a couple more things. The importance of having regular eye exams also apply to those who may have family history of keratoconus. So let's call that keratoconus suspect patient. So you may not have been diagnosed with keratoconus, but maybe your father, maybe your sibling, those who are close to you in the family tree as your direct bloodline relative, are often at a much higher risk level, which we have talked about again in a few episodes back. Higher risk level of developing keratoconus. And so even though early on in their life they may not have been detected or diagnosed with keratoconus, should still follow a regular eye exam schedule, just to make sure that that it's not going to surface at some point later down or later on in your life. And or if you notice if you notice some symptoms such as, in addition to say family history, but you've noticed, hey, my glasses prescription is always changing, my contact lens prescription is always changing, or requires some sort of refitting of the lens onto the shape of my eye, because the shape of your cornea is changing very frequently, that's not typical, or that you have blur vision or very poor visual quality that somehow cannot be completely corrected to your satisfaction by conventional glasses or soft contact lenses. And examples of poor visual quality can include seeing glare or halo or double vision, star bursting when you're looking at source of light, despite wearing the proper glasses and contact lenses that has been prescribed to you. So those are all symptoms to look out for, and again, to keep up with regular eye exam. So hopefully that answers your question, Scott.
Yeah, that's great. And along with that, especially for those with a family history, avoid habits like eye rubbing that can really exacerbate the symptoms of keratoconus. So I would just add that in, but excellent. That's a very common question we get.
Yeah, I couldn't agree more. Everybody, I always listen to Taylor, do whatever she says.
Well, our next question comes from Rebecca, who asks, how good are contact lenses to treat keratoconus, and what are some problems with using them?
Right. Obviously, every treatment has its risk and benefits, and it deserves a very comprehensive discussion with your eye doctors. So it's a great question, Rebecca. I just want to remind everybody, you've heard on the top of the show from Taylor that I am part of Wills Eye and the director of specialty contact lenses at Wills Eye Hospital. So I do want to remind everybody that, of course, I have an affinity to contact lens treatment options. But having said that, I also have been involved in pre-FDA clinical trials for corneal crosslinking, and so hopefully that keeps my clinical bias somewhat in check. So let's get back to Rebecca's question. I just make sure I mention that. Getting back to Rebecca's question, so specialty contact lenses are extremely effective in improving the visual functions to majority of the keratoconus patients. And we'll talk about some exceptions a little bit later, but all the majority, in regardless, very effective for majority of the keratoconus patients, almost with no regard to the degree of the disease severity, provided that the optimum fitting relationship between contact lens and the shape of the keratoconus cornea can be achieved. Right? And so the treatment effect is so effective that there's a recent study from Kellogg Eye Institute from University of Michigan that have found that the risk of requiring corneal transplant, because a lot of our treatment options are to defer the need for corneal transplant for keratoconus patients and make sure that they have great quality of vision and great quality of life. So if that's typically the sort of the goalpost that we compare against. So this study from University of Michigan found that the risk of requiring corneal transplant for those wearing scleral contact lenses is reduced by about 80% when you compare to their counterparts who do not wear contact lenses. And additionally, they also looked at the same risk with people wearing smaller diameter gas permeable lenses, or some people call them hard lenses. And that risk is reduced by about 66%, so about 2/3 of the risk reduction. And so it shows you how effective that the treatment efficacy of contact lens can be in improving vision. And I'm stressing that because I know that as soon as I tell you about that study, some people are going to misinterpret that the result of the study is saying that a well-fitting contact lens also stops keratoconus progression so that they don't require corneal transplant. That's actually not, that's actually a false interpretation. So I want to make sure I'm very clear. This simply just means that contact lenses are so good at improving your vision as keratoconus patients that most of them are so happy with their vision and leading very independent and productive life that they don't need, they feel like they could defer the need for further surgical interventions such as corneal transplant. So that obviously then may be one problem, right? It points to the problem that some keratoconus patients may be progressive, but they may not know it because they're seeing so well in their contact lenses, and then so they forget about following up with their eye doctors to monitor their keratoconus disease, or even general eye health, because they feel like they're seeing well. And understandably, some people interpret seeing well as being completely healthy. We know that's not quite true because other things can happen, like glaucoma, diabetic retinopathy that affects your eye. Those are not going to have symptoms until things are rather severe and sometimes even often irreversible. So make sure that, understand that yes, there may be benefit then combining a stabilization treatment like a FDA-approved cross-linking in US to stop the progression. And therefore, in my mind, combining that with improving your vision with a contact lens treatment can really then prolong the longevity of the treatment effect of your contact lens and the benefit to your vision over a much longer period of time. And a couple smaller challenges, because the second part of the question was what other problems can contact lens patients encounter. So other challenges may be ranging from some level of inconvenience, which such as patients really should not be falling asleep, or swimming or showering while they wear contact lenses on their eyes because of the potential for infection, or even possibly from contact lens overwear because they're seeing so well. They can't really do the things that they want to do without their contact lenses, so they wear the lenses for a very long period of time. So that kind of inconvenience, ranging from that to possibly continual progression of disease such as in their keratoconus. And because, like I said, they see so well, kind of forgetting to make sure that you follow up with your eye doctors to maintain, to keep the relationship of the contact lens to the eye if the cornea continues to change. So I think the lesson is to make sure that we're all doing a better job at reminding ourselves to go see your eye doctors for your eye exam, at the very least as keratoconus patients, at the very least once a year.
Great tips. I think that's wonderful. And there's so many different kinds of contact lenses for keratoconus patients that I think it's a great treatment option, because if a patient tries a lens and it's not a good fit for their lifestyle, there's a few different options that they can explore with their doctor. So I think the pros definitely outweigh the cons in this situation.
Yeah, absolutely. And so therefore, if people have any other questions about our listeners, different type of contact lenses, again, Taylor and I love to, answer your questions. So please just send your questions in about different type of contact lenses if you have them.
Yes, please do that. Okay, so our last question comes from Stacy. And Stacy asks, my son with Down syndrome has keratoconus and had an episode of hydrops. Will he go blind?
Yeah, that, and Stacy, obviously I feel your concern. I completely understand, and it does unfortunately happen to some of our patients as their disease progresses, which is again the importance of why we keep mentioning about regular eye exams and making sure that if there's any progression that is in the disease that is being detected, that there's a discussion about the treatment for FDA-approved cross-linking, which is currently the only method that we have in US, but we're very hopeful that other research in the future will come about as well. So keep listening and obviously keep your spirit up, and the same for your son as well. The question about if he will go blind, the silver lining, I would say, for most keratoconus patients, regardless of the severity of the disease, is that complete blindness, meaning inability to perceive any amount of light. That is extremely, extremely rare. It almost really never happens with keratoconus patients. So again, very rare situation. But that's kind of for those listeners who are trying to figure out what does hydrops mean. Let me just very quickly give a definition of what hydrops is. So as the keratoconus gets worse, the corneal tissue gets weaker. Imagine like a rubber band being stretched out thin, and you start to see area of whitening that appears because all the materials being stretched out and being stressed, and eventually if you pull too hard, it will break. So your cornea, as it gets weaker and as it's trying to maintain its own configuration, it can eventually get to the point where it can have a tissue tear at the layer called descemet membrane, which is towards the back of the eye. And behind your cornea we have a fluid chamber. So when you have a tissue tear at that location, you can then have a lot of fluid that enters inside of your cornea. Your cornea typically is very transparent to allow light to come in, so that you can have light signal going to the back of the eye and then produce an image for your brain to interpret. So when the fluid enters the cornea, your cornea doesn't really have too much mechanism to get rid of that fluid very quickly. So your tissue becomes, under the hydraulic pressure and stress, your tissue becomes hazy and white. And that edema or swelling takes months to slowly dissipate. And as it dissipates, during that period of time, your tissue is being stretched and it's disorganized. So when all the fluid, when it becomes compact again, as the fluid leaves, months and months after, it can actually leave a scarring from all that stress to the tissue. Now, again, fortunately, most of the time, that scar is not dead central where our line of sight is that the person's looking out of. So a lot of times, if the scar is not too dense, or that it's not centralized to block the line of sight, most patients can go back to wearing their contact lenses. Again, this is months after afterwards, when the fluid completely leaves the cornea. Then they could still continue to see well. They may require slightly different fitting because the shape of the cornea would have changed due to the presence of the scar and the episode of the hydrops. And your prescription may also change a little bit. But if the scar left behind is the opposite scenario, where it's a very centralized location, or that it's very dense and it does cover parts of the central vision, then it becomes very difficult for the contact lens to be able to help you focus light in the back of the eye to your retina. And therefore, even with the well-fitting contact lens, most patients will not see as well as they used to compared to before the hydrops. And so that is one situation where patients actually will require corneal transplant. And again, it's not complete blindness, but it is very poor functional vision. And so because of that concern, not wanting to get to that stage for our patients, especially because we have ways to stabilize the progressive keratoconus now in United States. And that's the reason why we kept stressing regular eye exams with your eye doctor, making sure that you yourself monitor your own visual symptoms about the quality of your vision, back in question 1 that we have answered. Because if you wait until hydrops and then play, Russian roulette with where the scar is going to be afterwards, cross-linking is not going to be very helpful at that point. And really, we're most of the time looking for corneal transplant as one of the treatment options at that time. So again, just let's all work together, make sure that everybody is educated on what to look out for and what treatment options are out there, and so that you could then combine your newfound confidence and peace of mind with the fact that you're very likely stabilized from the treatment option, so that you could have, you could see the best you can either with glasses or contact lenses, and that way you would have enjoy the best quality to your life. And that is what Taylor and I, and NKCF, obviously, and a lot of keratoconus specialists around the country, that's really our ultimate goal.
Great answer. I think that was wonderful. And NKCF is actually hosting a joint webinar with the National Down Syndrome Society later in October. So those of you that are interested in maybe tuning in for that, or if you can't make it, we'll have a recording of it up on our website, nkcf.org. But thank you again, Dr. Chang, for taking the time to answer some of these questions for our audience. Next month, look out for another episode with answers to more questions about all things keratoconus.
Absolutely. Looking forward to it. Thank you, everybody, for listening, and keep listening to us and keep sending your questions. Thank you.
And if anyone listening has a question that they would like answered in a future episode, make sure you go to nkcf.org, and under the For Patients tab, you'll see a Ask the Expert Chain Reaction button that you can click and type in your question. NKCF operates with the support of friends and donors. If you feel the urge to support us, you can make a much appreciated donation online to the UCI Foundation. In closing, I want to again thank you, Dr. Chang, for taking the time out of your busy schedule to answer our questions and just talk with us about all things keratoconus.
It's been so much fun. Thank you, Taylor.
Bye, everyone.
Bye-bye.